Hello, and welcome to the Unit 6 video for our class. My name is Eric Wasinski. This is my wife and tonight patient Amanda. Amanda, nice to meet you.
Nice to meet you.
Again, my name is Eric Wasinski. I'll be the MP student today conducting the examination. What we're going to be focusing on for this week's examination is the abdomen and your neurovascular system. So I'm going to have you laying down to begin with. I will expose your belly for a moment here. I apologize for the cold hands. I did just wash them. I gel in. At some point, I'm going to have you sit up. I'm also going to have you stand. I'm going to check your balance and your gait. You comfortable with all of that? Ready to begin the examination?
Yes.
So I'm going to lift this shirt up just a little bit. It's just to have your arms resting comfortably at your side. Do you have any complaints with your belly, your abdomen at all?
No.
Any prior surgeries or problems or anything like that?
No.
Nothing you take medications for on a regular basis? Is there any pain or discomfort with the light kind of gentle touch here?
No.
Nothing's hurting you right now? Okay. I'm going to take a listen. Apologies if it's a bit cold. Have to listen for a little bit of time. All four quadrants, I want to hear good bowel sounds, okay?
Okay.
Well, that didn't take long at all. Did you eat recently?
Mm-hmm.
Just a little low there. Cold, I'm sorry. Just breathe normal. You have what I would describe as normal active bowel sounds. All good things. I'm also going to listen to see if I can auscultate. That means to hear your heart sounds through the aorta that goes down there and anything abnormal like that, okay?
Okay.
You can hear the aortic valve, but no abnormal vascular bruits of any kind. Check for the renal arteries now. It's kind of tough, but if you go just lateral, do that gastro. You tell me if I'm pushing too hard and it hurts, okay?
Mm-hmm.
Again, all I'm getting is just normal bowel sounds, and I can faintly hear some of the waves of the heart, but no abnormal vascular bruits of any kind like that. What I might do for a subsequent exam would do an actual like femoral vein auscultation, but I'm going to leave that for now, okay? No need to undress the bottom half whatsoever. Please leave that up just for a moment. What I want to do is just kind of assess for the peristaltic waves, since you said you just ate. Make sure I can see kind of normal movements and feel some normal movements here. And I can, in fact, ever so slightly, but they're present. We also do something called tympany, so we check to see if there's hollow sounds or dull sounds as we move around. That's something we would classify as a very hollow sound, which we would expect upon most parts of the abdomen. Your liver is going to be located up here, so as I come up a little higher, and here it gets much more dull sounding. So we can take some very rough measurements and get probably about 6 centimeters the width of that, and if we come all the way up here, we might just be able to find the spleen. of discomfort when I press in here?
Mm-mm.
That's good. Take a big deep breath for me and hold it for a moment. Okay, you can breathe for a moment. Thank you so much. So, no sensation or rather no tenderness or pain when I palpate directly above the spine or on the liver. I'm going to do a little bit of deep palpation now, okay? You tell me if it hurts at all when I'm pushing in here.
No.
Any pain when I push in over here?
No.
No? Okay. So there's definitely, excuse me, no pain with inspiration. There's no deep liver pain. There's no rebound pain. The Murphy's point is negative. I want to check Rovsing sign. So if I push in on the left side, you tell me if it hurts at all on the right.
Mm-mm.
No. Anything on the left side? No.
No.
Anything on the opposite side? No.
No.
Very good. This is going to be kind of a funny one. I want you to lift your leg up ever so slightly against the, no, I'm going to lift it for you actually. Is there any pain there on your abdomen when I lift the leg up? Any pain when I tilt your leg in this way?
No.
Negative. Okay, that's great. I'm going to talk to the camera every so often as I'm going through this exam so the teacher knows what I'm talking about. So that'd be a negative psoas sign and a negative obturator sign as well. If I do some light pinching, you tell me if there's any tenderness there also, okay?
Nope.
Excellent. So that means that there is no cutaneous hyperesthesia as well. So for the next bit, I'm going to do the neuro examination. If I can have you sit up with me. Drop your legs off the bottom there. We're going to start off kind of head to toe. So I'm going to do the cranial nerves first. Okay, I guess the very first thing I should do is make sure your mental status is intact. Can you tell me your full name and date of birth?
Amanda Wasensky, 6885.
That's what I knew from the charts as well. Thank you very much, man. All right. So starting with cranial nerve 1, I have two things I want to test your sense of smell with here. So close your eyes and tell me if you can identify this smell.
Coffee.
Yes, it is.
It smells good.
The next one here.
Cinnamon.
Very good. Excellent. All right. Cranial nerve 2 is the vision exam. I cannot find for the life of me the actual Snellen chart that was given to me. So could you please read this homemade Snellen chart?
You are the best NP student I have ever met.
Her words, not mine. Thank you, ma'am. To test cranial nerves 3, 4, and 6, I want to do the, that's what we call a visual acuity test. I'm going to test the movements of your eyes, ocular motor. Okay, so just follow my finger with your eyes. Try not to move your head at all. Okay, we're going to go to the left. We're going to go to the right. We're going to go all the way up. We go all the way down. We're also going to go down, up, left, up, right, down, right. This is a bit weird one. We're going to go in a little bit. All right, so thank you very much. The pupils are equal around. I will check if they are reactive to light. Pardon me. Oh, where did my flashlight end up? That is not my flashlight.
Oh, the flashlight is
Pause one moment.
in the drawer downstairs.
Apologies. The pen light fell off of the countertop there. So I want you just to look right at my nose, if you could, for this one. Thank you very much. Okay. As previously stated, eyes are equal, round, reactive to light, and they accommodate as well. So facial sensation we're going to check with the next cranial nerve. So you tell me if you can feel. Yes?
Mm-hmm. Yep.
All those points there. It's going to be kind of weird. I'm going to touch next to your eye. Try not to blink. There you go. Did that kind of force your eye to blink? Okay, very good.
Mm-hmm.
Cranial nerve 8. You could repeat what I say. I'm going to whisper something in your ear.
This is the whisper test.
Very good.
Another whisper test.
Excellent. All right. For cranial nerves 9 and 10, can you just swallow your saliva for me? If you need a hand, I can give you a cup of water. Very good. Okay. And say the sky is always sunny in San Diego.
The sky is always sunny in San Diego.
Very good. As a speech pathologist, would you agree that your speech is normal?
Intact.
Intact. Very good. For cranial nerve 11, I want you to shrug up against my hands. Very good. Okay, and I want you to tilt your head to the side. Very good. Tilt your head to the other side. No pain or discomfort there.
No.
Not difficult to do in any way whatsoever. Okay. I want you also to close your eyes really tight and make a grimace face. And then open up wide. Let me see your surprised face. Very good. Excellent. And then if you could, last thing I'd have you do is stick your tongue out. And what is it you have the kids say? Patty cake?
Buttercup.
Buttercup. Say buttercup.
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 Very good. I would think that all of your cranial nerves are fully intact, so very good for that one. As moving on then to the motor examination, if you could stand up for me real quick. It appears as though, generally speaking, my patient's motor sensory is fully intact. If you could just walk over to the wall for me for a moment. Gait seems normal, and walk on back here to me. Any balance issues, any difficulty, you think that?
No.
All right. The next thing I want to have you do, it's kind of a weird one. I'm going to have you stand with your legs, your feet directly next to each other. I want your arms out at the side, about 90 degrees. And I want you to close your eyes. I'm going to be right here for you. I'm going to measure about 20 seconds, okay? 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Very good. No difficulties even for the group to fall over at any point. You can relax your arms back down again. Thank you very much. I want to do a little passive test here, so I want you to try to push up your arms against me. Very good. Pull them down against me. All right, you go ahead and sit down just for 1 second. Lift this leg up against me. And this one now. Push your legs out against me and pull them in towards me. Excellent. Okay, so no gross motor problems, paresthesias, pains, or great weakness of any kind, okay? For the sharp and dull test, if you're able to, tell me. It's not actually going to be anything pokey sharp. I just want to see if you can kind of discern as you're sitting there when I'm touching you with something that you might describe as sharp if you feel that. This is what I'm referring to as a sharp point, not a very, very sharp point. This would be a dull point. Actually, use this. Call that a dull point. So you can feel the difference on those, right? So I want you to close your eyes for me. Just to have a little bit of exposed skin here. And tell me if you feel sharp or dull.
Sharp. Dull. What if I get it wrong? Dull. I was like dull. Sharp.
Excellent. Okay. And we'll go
going?
down lower. Yeah, we'll do about 2 more spots. How about that? Okay. You tell me again, sharp or dull?
Sharp. Dull.
Okay. That's great. 2 more tests we're going to do. It's called stereognosis. I'm going to have you try to identify an object I'm going to place in your hand without you looking at it, okay? It's going to be something that you felt or that you've seen before, okay? So go ahead and close your eyes and tell me what it feels like I'm putting in your hand. You can feel it, you can move it around.
Scissors.
Very good. All right. And now, this is kind of a fun one. We're going to do something called graphesthesia. So I'm going to draw a number and see if you can guess the number. Tell me if it's too difficult, okay?
Is the number facing you or me?
The number will be facing me.
Okay.
I know, upside down graphesthesia.
5.
Awesome. Let me try the other hand. Is that a letter?
Oh, an H.
Yes, it was. Excellent. All right. The next part we're going to do is everybody's most favorite part, the tendon reflex. We'll start off with the knees, patellar tendon, okay? There it is. Now, you were telling me earlier that you feel like you have a spot on the top of your leg that can also react as such, so I want to try to test that here. Feels like it's up here? Okay. Approximately there. Okay. A bit of movement. Around this area as well?
Probably like there.
Okay. Interesting. It is reacting. All right. The next one I'm going to do, I should be able to find your biceps. This is a bit of a tricky one though. I'm going to have you actually lay your hand down. Just totally rest it, okay? Totally relaxed. I should be able to find your bicep tendon. I'm not going to actually hit your bicep. I'm going to hit my finger on top of it, and it might, it ought to react. Pull your hand in. Right? You're feeling it at all?
Do you feel it?
Yeah, that time it tensed. I'm not sure you can see this really, but approximately on the,
Do you want me to turn around?
no, that's all right. Tricep tendon here. Let me refresh on this. The bicep tendon is the front. I'm doing the wrong test. I apologize. Your bicep tendon. There it is. You felt that one? Yeah.
Yeah.
Okay. With the tricep, actually, you have to have your arm ever so slightly, not quite all the way up, but you want to have your palm facing inwards. Flex your arm ever so slightly in. Yeah. No, I'll hold your arm up. We should have this joint completely relaxed. There it is. That's going to be a little bit funny. And then the last one I'm going to do is the Achilles. So I'm actually going to hold your foot. I'll be gentle. There it is. Okay. And that concludes the examination for this time. Thank you so much.
Thank you.
Thank you for your attention.